Hello and welcome to another episode of Rewiring Health. I'm so excited to be joined today by Dr. Spencer Blackman. Dr. Spencer Blackman has been working in outpatient physical therapy for 6 years after graduating from SUNY Upstate Medical University in 2016 with his doctorate in physical therapy. Before that, he graduated Summa Cum Laude from Slippery Rock University with a bachelor's in exercise science. Spencer's true passion lies in working with and treating patients suffering from chronic pain and conditions. He has spent the last 3 years of his practice focused on learning how all aspects of the nervous system influence pain, recovery, and chronic mobility problems, as well as the ways to positively impact them. He has adapted the mechanisms of pain science interventions, laterally training, and graded motor imagery into a treatment system that targets the originating sources of chronic pain. He is trained in Autonomic Awareness Training and Blomberg Rhythmic Movement Training. He hopes to continue pioneering cutting-edge ways to resolve chronic pain through his research, interest in chronic neurological conditions, and the science of pain interpretation and protective responses. So I'm so excited to be joined by you, Spencer, today. Spencer and I have known each other for probably like 9 years now. It's been a while. So I think it's awesome that we can like reconnect under this platform. But yeah, we met each other in physical therapy school, and it's great to see how you've progressed, especially working with chronic pain, which is my interest as well. And it's been so awesome just to like connect, through our conversations, but now to have you on here to discuss what you've been doing and working with it. So one thing that fascinated me about what you're doing is you had talked about histamines and your research in histamines and how it relates to chronic pain. And I think that's such an amazing thing because it's new to me as far as I haven't seen a lot of that research or even heard much about that. And there's so much complexity to chronic pain that I think it's amazing to now see another element that may be influencing why people are experiencing chronic pain. So do you mind just touching on, like, first of all, just what are histamines and how it affects the system?
Yeah, so thanks for having me. I appreciate coming on and talking.
Yeah, absolutely.
So histamines are interesting. Most people have at least a vague knowledge of histamines because that's the primary chemical associated with allergic reactions, right? And so if you ever taken Benadryl or Zantac for stomach issues, those are antihistamines, right? So histamines are just these small little neurotransmitter-esque molecules in the body that trigger a bunch of different responses, usually around the heart and lungs and digestive system is commonly how we think about them. And those are because they're peripheral in the body, and those are the ones that we have medications for. So those ones get talked about. What doesn't get talked about is that histamines are actually also a neurotransmitter in the brain. And so those neurotransmitters in the brain use a different receptor that we don't have drugs for, so we don't talk about them, right? And so they sort of just get pushed to the side and we go, okay, it's an inflammatory response chemical. It's a chemical that's just going to make me have hives or have a asthma attack, or if I get inflammation, okay, it's histamine response. So that's typically how it's framed, and oftentimes it's been neglected, in my opinion, in how they look at it. It's what it's doing in the central nervous system, and just because it goes everywhere, right? So it's only produced in one little small part of the brain, and then it gets sent out all throughout the brain, and they just go, oh, okay, it's just like all the other, serotonin, dopamine type ones. It's a chemical that talks throughout. But histamines are more intricate because of the effect that they have. So most of the other neurotransmitters have a large impact on the nervous system and a little bit of an impact throughout the rest of the body, where histamines seem almost to be flipped, where histamines talk very loudly throughout the rest of the body, and then seem to do a little bit of talking in the central nervous system in the brain. But that shouldn't be overlooked when we want to understand chronic pain, right? So chronic pain and conditions come from a breakdown in the mind-body connection, right? And so when there becomes a problem in the mind and it can't figure it out, it uses the body to help solve the problem, right? And so basically I hit an unsolvable problem and then I bring the body in to help respond. So if I have a fight or flight response because I think that everything is trying to get me, right, then my system is going to upregulate and I'm always going to have that underlying tension and this anxiety of what do I do, that type of response, right? It's still originating in the brain because I'm making the assessment of where is the threat, where is the danger, why is this situation safe or not safe, and that triggers the chemical release throughout the body of, you know, adrenaline and cortisol and stress hormone. So I take a very different approach than most people because I like to start at what I call the neural software. So neural software is sort of like software of your computer where you can do all the scans, all the images, take the computer apart, look at all the pieces and go, everything looks like it's put together the way that it should, but I'm still getting the blue screen of death. And you go, well, it must be something, you know, in my computer that's wrong. And we overlook the software component. And so you can't just take a picture of the software, right? It's crucial to how everything works, but you can't easily see it, right? It works in between the pieces. And so when I treat, I want to go after the neural software that ends up creating the muscle tension, the protective responses, the chemical releases, the endocrine releases, all of that stuff. So when I look at something like histamine, I'm absolutely fascinated by how it all plays together because it tells us the cohesive story. But then the end goal key is, how do I change the software that changes the release of the histamine? And that's where today's discussion will get very interesting because the behavioral components that generate the histamine release in the central nervous system is a very intricate story that becomes very hard for people to parse out when you just look at the chemicals or you just look at the behaviors.
Yeah, and just kind of touching back on a few things you said, because I think it's so common, you know, I mean, histamines are a pretty common term, you know, many people have heard of histamines, but I love how you differentiated how it's affecting the peripheral system, so the rest of our body versus the central, and how, you know, we really don't hear about how it affects the central nervous system and how it's such an integral part. So that was one thing I really liked how you touched on, because I think it's fascinating, you know, there's just another element that's influencing why people are experiencing chronic pain, that if you're not addressing the root cause of it and what's actually going on, you know, again, we're not going to see long-term results with that. So I think it's so important that you're addressing that. And I also love your analogy of the software, you know, kind of versus the hardware, because it is true, you know, a lot of times when we experiencing chronic pain, you know, it's a frustrating thing, but you can't, because imaging doesn't show the extent of pain, you know, nothing is going to show the extent of pain because there's so much complexity to that, and it is, you know, a disruption of the nervous system. So I think just adding that element that you talked about with histamines and how it affects that, it just gives another picture of what's going on and why it's so complex. As far as, you know, what we do with that, so if first of all, a couple of questions I have: how do you determine if there is like a histamine disruption or dysregulation? How would you do that in someone?
So there's a couple different disruptions that will play out. So there's a group that you will see that the disruption is largely seen in the peripheral body aspect of things. And so those groupings of people often have like mast cell overactivation symptoms. So they easily react to everything. There's often digestive system component that gets thrown off. They have a lot of very strange symptoms that doctors have a very hard time giving a name to, right? And they go, okay, you're having some swelling, but it's transient, it comes and it goes. You might have a heart murmury type thing going on, but then that goes away. Geez, maybe you're having some trouble swallowing, and it tends to move all over the place because that's what the histamines do. They get released oftentimes in the peripheral part of the body by mast cells, which are an immune cell that stores histamine, and it's sort of your frontline defense of it. An invading virus or bacteria or fungus comes in contact with the body. A lot of this is at the skin level. The mast cells become activated, they release the histamine, and then that causes inflammation and triggers the rest of the body to go into your immune response, right? So there's a lot of immune dysfunction as well in this population. So that's one population where you could see a very distinct histamine dysregulation. But then there's also a group that you're going to see that is central nervous system histamine dysregulation. And that group is harder to pin down because there's so many other neuromodulators and neurotransmitters at play that it gets hard to go, well, it's this one that's disrupting things. But this is why knowing the pathway that it takes makes it helpful to sort of untangle why certain things are happening. And so most people in our realm are aware that the autonomic nervous system dysregulation seems to have a huge impact in driving pain and a lot of other dysfunctions that we run into. And so a lot of the modalities that we use are aimed at treating the autonomic nervous system. So whether vagus nerve, stimulation, or breathing is all aimed at trying to re-regulate the autonomic nervous system. And for those that don't know, the autonomic nervous system is two different branches. It's two parts that come up in the umbrella term for both of those parts together is autonomic nervous system. And it's the automatic portion of our nervous system. So the stuff that happens automatically, you don't have to think about it. And so one half, most people know, is the fight or flight response, right? And that's the sympathetic. And then there's the rest and digest nervous system, or the parasympathetic nervous system. And so the way that they often talk about it is that if you go into fight or flight mode, you hit the brake on the rest and digest. And then if you're not in fight or flight, that stops, and then you go into rest and digest. So kind of gas pedal and brake type motion. In my opinion, that's not quite accurate, because whenever you have a dysfunction in the parasympathetic or the rest and digest component, they say, well, it must be because I'm in fight or flight response. And that very much doesn't seem to be the case, especially as it relates to histamines. And so I'm going to walk through the pathway a little bit to make a little more sense of why that actually happens, because the histamine pathway is one of the modulators of the autonomic nervous system, and one of the things that puts the check on the autonomic nervous system to see if it's functioning as it should. So the fight or flight response, right, is getting all the attention. Saying, if I got somebody who's in chronic pain or having significant issues with their nervous system, it's got to be that fight or flight response is kicked up. And in the population that you'll see where the histamine level is the driving force, is that there doesn't seem to be a strong connection between their fear response and their dysfunction, because they could be perfectly calm and still majorly dysfunctioning, and sometimes worse when they're calm than when they're not. So this would be migraines, where people go through a stressful event and everything like, wow, I didn't get a migraine. And then the next day, bam, they get hit with a significant migraine because it seems that histamines are one of the major drivers of migraines as well. So if we look at sort of where histamines originate in the brain, there is one grouping of cells that makes basically all the histamine in the brain. And people don't need to know this, but it's called the tubomammillary nucleus, right? And so this little collection, which is part of the control system of the brain, the thalamus, right? And that's oftentimes thought of as your temperature regulator and all of that, makes histamine. And then the histamine is going to be released all throughout the brain. So one little place makes it, and then it gets released into a whole bunch of different pathways and does a whole bunch of actions. This is why it's so hard to track. And so one of the primary pathways that it takes, though, is to the amygdala, the fear processing center, they call it, but it's really more complex and much more to do with memory than it does fear. But that's where your autonomic nervous system activations come off of. It's very much regulated by the amygdala, right? And so histamine is sort of a backup chemical that can interfere with the typical chemical that the amygdala uses to communicate. So typically it uses acetylcholine, and that chemical is crucial to how the whole parasympathetic nervous system talks, right? That's sort of its language. It's going to be acetylcholine. And histamine acts as an anticholinergic or an anti-acetylcholine activator. And this comes in to try to regulate your amygdala. So normally, right, you would have your prefrontal cortex, right, talking to the amygdala to calm it down. So when the amygdala starts freaking out, you start getting a fear response, oh gee, something's wrong response, but the medial prefrontal cortex comes online and says, no, we're okay, everything's fine. And then it goes, oh, okay. And then your nervous system, your parasympathetic nervous system and your fight or flight response come back down and goes back into normal regulation. The reason that I talk in detail about that is because this is where a huge component of breakdown will occur. And understanding that this is where the breakdown occurs is crucial to knowing how to actually start to solve the problem. So you have your amygdala freaking out, causing your autonomic nervous system to freak out. And then that's going to impact your digestive system, your heart, obviously. It's going to release a whole bunch of endocrine hormonal responses throughout the body. And then that loops back up to a center that sits up in the brain that looks at the chemicals in your cerebral spinal fluid. So it goes out to the body and then it comes back to the brain in the form of chemicals. And you got a part of your brain that sort of analyzes all the chemicals of the brain. And it goes, how well is my nervous system functioning globally, right? And then that triggers to the part of the brain, what's my next step for safety purposes? And then that can trigger histamines to be released. So if you have a dysfunctioning autonomic nervous system, it can become a positive feedback loop that creates more histamines in the body because it goes, oh, I'm not safe, things are wrong, better start releasing more histamines. And this is why dietary changes oftentimes will make people feel better because you've changed the chemical compounds in your bloodstream that make it into your cerebral spinal fluid that then calm down that center. And so it works to change diet. This is why some people do feel so much better on keto or carnivore diet or vegan diet, right? Whatever the system needs in order to externally control the chemicals in the peripheral body to tell those two parts of the brain that come before the release of histamine that, okay, we've got a balance.
Mhm.
Now, in my opinion, that's simply not a fix, it's a management, because if you come off the diet, all your symptoms come back, and sometimes worse, because that area analyzing the spinal fluid is saying, oh no, here we go again, we're in danger. Better ramp everything up, not realizing that it's the histamine release in the first place that caused the dysfunction to start.
Mhm.
Right. And so now you've got this feedback loop that's perpetuating itself without realizing that it's perpetuating itself.
Mhm. Right. And just a question off of that, do you find that as far as the prefrontal cortex and its regulation of the amygdala, does the histamine that's circulating through the system once it's released affect that communication between like the rational brain and like the primitive brain?
No, so typically not, because
Mhm.
histamine breaks down very, very quickly. And a lot
Mhm.
of histamine in the peripheral body doesn't pass the blood-brain barrier.
Mhm.
So if I have mast cells releasing a bunch of histamine in my body, that histamine doesn't typically make it into the brain.
Mhm.
It's most of that is blocked, and then the little bit that would try to get across usually breaks down before it would get there.
Okay.
That's why it has to come back through the fluid
Mhm.
and get analyzed in your cerebral spinal fluid. So
Mhm.
it's sort of like looking out into the body rather than all the stuff in the body coming into the brain.
Mhm. Yeah, I think it's fascinating as far as, again, all our systems are designed to create homeostasis in our brain. And when we have something that's disrupting that, we have all the regulating systems, but again, that can manifest as, physical symptoms, mental systems, emotional symptoms. How would you say, if someone's having that feedback loop of histamine, I know you touched on some things as far as like migraines, but what are other physical symptoms that that person might experience from an exaggerated histamine response?
Yeah, so there's a good number of responses that'll happen. So they think that a decent number of asthma is an exaggerated histamine response. Allergies are exaggerated histamine response. There's some memory, emotional control things that are exaggerated histamine response. Um, Vertigo and motion sickness
Mhm.
is also an exaggerated histamine response, because that makes the vestibular processing area of the brain much more sensitive.
Mhm.
And so even if you think about motion sickness, the sensation of motion sickness, the sensation is not that you're spinning.
Mhm.
The sensation is, oh my gosh, I'm super, super sick right now. But you'll notice a temperature change. You'll notice this pulling in of the gut and this super uncomfortable feeling. That is a histamine response. And that histamine response is in the brain that's then impacting what's going on in your body. And so they found that if you can tamp down your histamine response, you can actually tamp down motion sickness. And that's why most anti-motion sickness medications are antihistamines.
Mhm.
So there's a number of those things that you'll see. Also, disruptions in sleep can be a histamine response, and major disruptions in appetite, because it's one of the primary neurotransmitters of taste perception and appetite perception.
Mhm.
And and this is where, for eating disorders, it's very interesting, because in eating disorders there are two main chemicals that are in imbalance when they look at the brain: serotonin, which most
Mhm.
people will be aware of, right, and histamines.
Mhm.
And the histamine part is strange, because when they look at it they go, okay, well, sort of what's going on here. And a lot of it has to do with the histamines are released in order to sort of stop the body from wanting food, right? And so it prevents you from wanting to have food. But
Mhm.
there's an even more important piece, which is how the brain makes choices and which chemicals are involved in those choices. And so if you're in starvation and then you come out of starvation and you eat a lot of food, your body actually releases histamines to keep you from eating more, right? So there's one pathway. But the other one is histamines are also connected into choice making. So not only does the histamine go to the amygdala, the emotional regulation, parasympathetic nervous system path, but it also goes to what's called the striatum. And the striatum is what they often call the reward center of the brain. And so when they watch somebody make a choice who has an eating disorder versus somebody who doesn't have an eating disorder, and this was done specifically in anorexia nervosa. So it's a little bit different in bulimia and a couple other eating disorders, but they think that it's all relatively similar. And so when given the choice between a piece of chocolate cake and carrots, most people that don't have an eating disorder are going to use their medial prefrontal cortex to make the decision of which one they should choose. In patients with anorexia, they use the striatum. And that's oftentimes linked with habits. And the piece that makes it interesting, though, is that there's a direct pathway going from the part of your brain that makes histamines to the striatum that's going to be its primary talking point. And the reason that's going to become important is because there's a part of your brain that precedes that release that's doing an interpretation of what the correct thing is that I need to do. And so it looks like, oh, okay, the histamines is the primary problem because it's its primary form of communication, right? And so notice I had talked before, the medial prefrontal cortex calms down the amygdala. The medial prefrontal cortex is also making the decisions on what food I should eat when the system is not dysfunctioning. In the dysfunctioning system, right, and we'll get to why it dysfunctions in a minute, but when it dysfunctions, instead of it becoming the medial prefrontal cortex in charge, the histamine system becomes in charge. And so that system is now acting to try to regulate your amygdala and becoming in charge of what decision you make, right? So it becomes that almost impossible to overcome thing where it goes, I have to choose the carrots. I have to choose the carrots. I can't choose the cake. And it takes so much effort to overcome that, right? And so the question from a software perspective is, why is the mind making that calculation decision? Why is it calculating everything that's going on and saying, this is the thing that I need to do, right? I have to take this pathway and not a different pathway. And that actually goes all the way back to the first, it's definitely prior to the first 4 years of life. And it's probably within the first 6 months of life. So super early, super out of our control. And understanding how the mind is sort of built is helpful in this. So when you're first born, you can't use your mind well because you don't have enough information to make good predictions. Like you don't know how the world operates, right? You haven't experienced enough stuff to start going, oh, okay, this is going to happen next, right? This is going to happen next, because essentially all of psychology is built off of prediction. So everything in your psyche, everything that your brain is designed to do is to try to make a prediction about the future and what the best thing for my body to do in the future is going to be. The body itself is actually very different, because the body itself doesn't care about the future at all. The body only cares about the present second. And you really see this when somebody gets knocked unconscious. When they get knocked unconscious and take the mind offline, the body just stays there. Your heart still beats, your lungs still work, but the pacing of both of those is different, right? You'll still clot, you'll still move everything that you need to move. But most of that communication, interestingly, is done by histamines.
Mhm.
So histamine is sort of the native language of the body without the mind, which is why if you have a histamine type response, your mind actually has zero idea of why that happened.
Mhm.
It just goes, "Oop, well, the body's taking care of it." So the mind uses a whole coordination effort of things in order to solve stuff. And in that, the mind is all about prediction, right? So basically you can boil it down to one theory, which is prediction theory in the brain. And so in the beginning, you can't make a prediction. So you end up having to rely on external sources to help you regulate your nervous system. And so that's what they actually see, is that in the beginning of life, babies' amygdala, their fear processing center, is regulated by the presence of mom, typically. That's just how the study was set up, probably influenced by other caretakers, but we know that it's regulated by mom. And so in the very beginning, amygdala is basically solely regulated by mom, and the prefrontal cortex doesn't do much of anything. If mom is neglectful or abusive or non-existent, what happens is the medial prefrontal cortex will come online too soon before it has the tools to regulate the amygdala well. And so I work with a clinical social worker who's one of the most brilliant people I've met. And he always says, when it comes to eating disorders, from what he's seen, is that if you have anorexia, and just about everybody that he's met with anorexia, they have a parent who is narcissistic and controlling. And if you end up having bulimia, you almost always have a borderline parent, right? A parent with borderline personality disorder. And so the question would become, why is my parent's behavior so predictive of having an eating disorder? And it has to do with that early learning piece and how predictable my parents are and what their idiosyncrasies about how they interact with the world lays the foundation of how I'm going to function. And so there's a part of the brain that tells the part that makes histamines to be released what it should do, and that has everything to do with maternal behavior and sexual function, right? So two very, very important foundational pieces that are going to connect all of this stuff together. So I'm being regulated by mom and dad, and in a system where that's good enough, the prefrontal cortex learns to take over that role and act as an internal parent. In the systems where there was so much dysfunction, especially early in life, the medial prefrontal cortex comes online before it has the tools to do that well, right? And so now you create an internal dilemma where the mind goes, I'm running into problems I don't have answers for, which means I need the body to solve the problem. And when that arises, it has the native language, histamines, that it's going to end up releasing that says, okay, body, this is your job to solve. And the body will do that. The body goes in and it changes your immune system function. It changes how responsive you are to everything. It changes how you make decisions. It changes how you regulate your nervous system, but it does it without the influence of the mind, because the mind was not useful in problem solving in this situation. And this is where the dysfunction ends up kicking in, is because now we've introduced an issue that needs to be solved by the mind, and we're trying to solve it with the wrong tool. And then it feedbacks loop, because it's created the dysfunction that reinforces, oh my gosh, there must be a problem in this moment, not realizing it is the problem.
Yeah. And yeah, I think you touched on so much there. I want to kind of circle back a little bit, because
of course,
I think one thing I really like is how you differentiated, between anorexia nervosa and then bulimia and binge eating disorder, because they do present very differently. And as far as the wiring in the brain, they're very different too. So I know you touched on the reward center for anorexia, and typically that is after they've performed a behavior. So, restricting food or making different food choices, that's usually when they get the reward system, versus binge eating disorder or bulimia. The reward is usually prior to what occurs. So it's that high that you get when you're going to eat an excessive amount of food. That's your reward. And then usually there's the guilt and shame afterwards.
Mhm.
So our brains are wired very differently with both of those, which I think is so interesting to talk about and also to recognize, because a lot of times I think people who go through eating disorders think, I have terrible willpower. How do I keep on relapsing, going into these phases? But when we recognize that this is actually wired in our brains, it makes you realize that this is a real thing. This is not just a lack of self-control or whatever that's hindering you there. Another thing I know you talked about is the developmental part of it, as far as what your parents are exposing you to, or your caretaker, and how your brain develops based on that.
Mhm.
I had a question off of that. So as far as how our brains develop from that, I know you talked about how there's the brain can't figure out how to problem solve because of that feedback that it's getting, and it sends it to the body. Do
Mhm.
you as far as the histamine interaction there, what is something someone could do who's maybe experiencing an eating disorder and is getting that dysregulation with the histamine response? Because one thing with like eating disorders, I don't want it to feel like, oh, well, you had this happen in your early childhood years, and then now there's nothing you can do because your brain's functioning this way. How
Mhm.
would you go about, or have you seen any research as far as how we can change those feedback loops so that it's not just that you grew up from age 0 to 4 and this has changed your brain and now this is forever? Are there things that people can do to change the effects of histamine and how it's interacting with the brain and perpetuating some of those eating disorder behaviors?
Yes, and so it's a little bit trickier to explain because we don't typically think of the world in this way.
Mhm.
We don't normally think about ourselves as a two different people operating the same body. Um, but that's kind of how the system works. It's not a perfect representation, but it gets us in the ballpark. And so I explain it oftentimes as it's kind of like if the body is one of those student driver cars with the two steering wheels and two sets
Mhm.
of pedals. And you've got your conscious mind, the version of you that you're used to thinking of, right? The thinking part, logical, rational, reasoning part of you. That's like the student driver who
Mhm.
knows where they're going and goes, okay, this is how I'm going to get there. And then sitting next to them is the subconscious mind, and that is the teacher that sort of teaches you like how to do things well,
Mhm.
but then sort of takes a backseat role and wants to hit the brakes if you're missing something, and will steer you off the road if it thinks that you're making a bad decision and going to get us killed.
Mhm.
Um, and so in order to solve it, you don't need to solve the student driver. You need to solve the teacher, right? The driving teacher. And so you have to navigate the subconscious mind in order to put in the tools, the solutions that it's looking for. And that is not done in a rational form. It's done in the world of analogy, right? And so if I say, um, if you're a hammer, everything looks like a nail, right? That's an analogy that people use of if you specialized in some practice or whatever, everything, every solution looks like, oh, I've got the solution because I'm a hammer and this is going to work. Um, so even though you gathered a whole bunch of information about oh, okay, yeah, I get that. I wasn't talking anything actually about hammers and nails.
Mhm.
But the subconscious part of your mind, that's how it operates and extracts information. Because the details aren't important.
Mhm.
The conscious part of your mind, the details are everything,
Mhm.
right? And so if you navigate into the realm of the subconscious, the part of analogy, you can actually start to give it solutions to things it didn't know it could get solutions to. Because as the mind sort of developed, that was the whole reason that we have a conscious mind versus a subconscious mind, is that if I'm operating and the details aren't important, it only gets me so far, but then I'm going to run into problems that I can't solve
Mhm.
because the details are important. The conscious mind goes, oh, I can see all the details and I can figure this out and give the solution to the subconscious mind. The
Mhm.
problem is when those two stop talking, or it becomes so disconnected that your conscious mind doesn't know what the problem it needs to solve is. Right.
Mhm.
And so you, in order to solve it, you have to link the sensation from your body, right? So you start from the source, find what the subconscious is reacting to, and then give it the solutions, right? So I do that by linking symbols to sensations, right? Have them draw a symbol that represents the feeling that comes up, so that then I can actually start going through, all right, how do we solve this problem, right? Because you have to engage the problem solving conscious mind to solve the illogical subconscious mind problem. And the only way for you to see that is basically through symbol, right? And so that's how I navigate down to that. And when it comes to the histamine response, it's a very particular pathway. Um, and so you find the response of, I can't logically figure this out because the histamine does not talk to the mind, which makes it very hard because the subconscious mind goes, we have a problem here, and I can't even identify what the problem is. So how am I going to solve it? But that always also has a link. So there's a component, there'll be like if somebody has an anaphylaxis or a major vertigo-y spinning sensation, there's a component of the body trying to solve things, right, on its own through histamines. And then the mind is also introducing a problem into that equation that the body's trying to solve, but can't solve because it's not happening right now.
Mhm.
And so you find those ones, and then it's very interesting because to do it for histamines and in order to change these patterns, you have to change your baseline. And in order to do that, you have to give tools to the part of your brain that's making those initial calculations that your parents never ended up giving you,
Mhm.
right? Because their idiosyncrasies taught you that certain things about the world were unsafe, even though they weren't actually a threat to you.
Mhm.
They may have been a threat to your parents when they were very young, but to you, when you're an infant, those same threats aren't there,
Mhm.
but you were taught that they were. So
Mhm.
now it starts searching for those. And so when you give it the tools that it needs, and the subconscious mind working off analogy goes, oh, I didn't know that was available. Oh, I didn't know that solution was possible. Then it actually starts to go, oh, okay,
Mhm.
I don't need to run the old operating system anymore. I
Mhm.
don't have to tell the body, hey, solve this because I can't. It goes,
Mhm.
oh, there's not a lion in the ring.
Mhm.
There's there's not anything I need to be nervous about. Oh, there's no problem to solve. And
Mhm.
so then the mind's able to settle, stops telling the body to solve the problem, and then it starts the feedback loop is going, oh, now things are regulated better. I'm not having to use histamine to regulate my amygdala, which dysregulates my parasympathetic nervous system, and then the chemicals and hormones that get assessed in your spinal fluid alter as well. And so now you've created a negative feedback loop instead of the positive feedback loop. And just
Mhm.
so people who might not understand what that means is, a negative feedback loop is a process starts like a thermometer in your house, right? You're like, oh, it's too cold, so I turn the temperature up.
Mhm.
And once the temperature gets up to 73 or whatever, it turns the heater back off,
Mhm.
right? Where a positive feedback loop is I turn the thermometer on and it goes, oh, it's getting warmer. Good. Let's make it even warmer still. Let's make it even warmer still. And the temperature just keeps rising and rising and rising, right?
Right.
And so you want to have the negative feedback loop that shuts the process off when it hits homeostasis,
Mhm.
not keep forcing me further and further out of homeostasis, because I think that's the correct solution.
Mhm.
So yeah, you can't fix your parents.
Mhm.
Doesn't do you any good to blame your parents, because that typically doesn't solve it either. Um, but you still have to recognize that they played a role in setting sort of your foundation of understanding the world, right? That's why you're raised in certain households, you have different views of the world, especially when you first leave the house and when you start learning, hey, things are a little different than I grew up in. But you don't know that until you moved out and experience new things. But they are foundational in sort of how you construct the world and what you think the world is going to act like. And then it's just getting the information and the tools to the part of the brain that needs that updated information to say, yeah, my parents weren't perfect. And some of the information that they taught me, usually without even knowing that they did it, wasn't 100% accurate.
Mhm.
And here's a much more accurate way of viewing it.
Mhm.
And then the body goes, yeah, I agree, that's much more accurate.
Mhm.
I'm not going to keep releasing the histamines.
Yeah. Yeah. And I like how you talk about the thermometer, because especially with like chronic pain conditions, I mean, that's what's happening is the cycle just continues to happen. So the more pain you have, the more you perseverate on it. And then the more everything else continues to happen, the hormones and the, neurotransmitters are, out of whack, and everything gets dysregulated. So it just perpetuates the cycle. And for anyone who's experienced chronic pain, it's beyond frustrating, because I think society kind of tells you that either it's not real or that you can control that, and that just again continues to perpetuate it. So I think it's so important. I like how you explain that, as far as like this is how the system is set up, and until we provide a different stimulus to that to knock out that cycle, that's nothing will change until that occurs. So
Exactly.
yeah, I think I like how I really like how you explain that. Also too, touching on the subconscious mind and the conscious mind.
Mhm.
I think, some people just you don't realize, you don't know what you know until you know it, and I
Mhm.
think a lot of us work on that kind of that autopilot, and we don't even realize how many influences we carry with us throughout our childhood, that we have all these, perceptions of ourselves, of the world, of others. And, some can look back on their childhood and be like, yep, that was the moment that made me think like this. But for some, they may look back on their childhood and be like, no, I had a good childhood. Why do I still feel like this? But it can be even micro traumas that occur, and
Mhm.
or small things, or it could be a teacher that made you feel a certain way, or someone else that was a role model in your life that can make you feel a certain way, that then you carry that with you as well. So I think it's so important that we recognize that. I like how you brought up the parent example, but I think there's also so many more influences that can affect that, and how we perceive ourselves as far as chronic pain, but also eating disorders, which is crucial. And a lot of times those go hand in hand because of the way our brains get wired from that, which is,
Exactly. Well,
yeah,
there are two symptoms of the same problem. It's just
exactly.
which solution am I going to use in order to solve it? So
Mhm.
if altering my eating behavior gives me control and ability to make a prediction to create some feeling of safety inside my nervous system, then I'm going to start using that. And now I have an eating disorder. But it also could be that my body goes into a protective response, trying to keep something from happening or preparing for something, and that can generate a pain response, right? And so it stems from the same source, right? It's just what symptom are you going to get?
Mhm.
And so it's like
Absolutely.
you could get a virus like let's say COVID. And it's like,
Mhm.
okay, we're getting the same sort of underlying virus, but the symptoms are varying very significantly. And
Mhm.
it's the exact same thing. It goes back to the same sort of initial piece, initial malfunctioning. And then it comes down to what solutions were successful for you at the time that this
Mhm.
arose. And
Mhm.
that's ultimately going to end up being your primary pattern that you run into.
Yeah,
Uh,
absolutely. I think it's, as far as how typical treatments of chronic pain, it's all about, masking the pain rather than addressing root cause. And
mhm.
that's the main issue until you actually get to the root of it. You think about when you go out and weed, if you just clip off the leaves of the weed, it's just going to grow back and it might grow
Right,
back bigger. But until you actually pull the root out of the ground, then that's when you actually get somewhere as far as removing the weeds. And,
exactly.
we have to address it that way. Otherwise, if you look at chronic pain rates, they just continue to explode. I mean, they're increasing, but yet the amount of money we pour into the system is billions upon billions. So what we're doing now as far as addressing chronic pain is not working. It's just masking the problem and perpetuating it. So
Exactly.
yeah, so we have to get to that root. And unfortunately, if we get to the root, because it's a very similar root cause with eating disorders and chronic pain, you can actually, solve or at least work towards healing in both if you actually get to what's going on, which is that nervous system dysregulation.
Exactly.
So yeah, no, I think I really like how you brought that in, and then just to add that histamine component, it really makes you think about how intricate our systems are, and our day-to-day life when we're experiencing chronic pain or eating disorders, we can really get hard on ourselves because how can I not solve this for myself? But when you get down to the meat and potatoes of it, there's so many influencing things, and you have to break the cycle before you can get any kind of healing from that.
Yeah. And for the people that beat themselves up because they go, why can't I gain control over it?
Hmm.
I like to use the example of this part of the brain operates just like if something came flying at your head, let's say a beach ball comes flying at your head, and you move real quick to get out of the way.
Hmm.
Right? And then comes the thought of, oh my gosh, what was that? Right?
Hmm.
You moved first
Hmm.
before you even had a chance to think about it. These centers of the brain precede conscious thought,
Hmm.
right? And so you've already started the action of
Hmm.
altering how you eat, your drive, or what you're going to choose before you even get a chance to think about it. And then you have to try to backtrack and prevent that from happening. And that's why it always feels like that's a losing task, is because
Hmm.
you're up against the part of your system that's saying, I need to do this for survival.
Yeah,
Right. This is an
absolutely.
important thing for survival. And the logical part of your brain's like, this is a beach ball. That
Hmm.
wasn't going to kill me. But the illogical part said, yeah, but what if it was an arrow?
Hmm.
If it was an arrow, I would have died. So I had to make a snap decision real quick and
Hmm.
activate to keep us safe. And then I'll let the logical system assess what's all the details around it. Was that the right choice, the wrong choice? So
Hmm.
yeah, it's easy for people to beat themselves up when they don't understand where it's coming from,
Hmm.
because it's like, oh my gosh, if I just had more willpower, you're like,
That.
well, that's like, yeah, I guess if you have enough willpower, maybe you can stand there and take a arrow or a beach ball as it comes flying at you, and not, but that takes a lot of suppressive effort that's not usually healthy either.
Mm-mm.
So it
Yeah,
ends up all feeding in.
and to what cost? Because again, very draining. Willpower is a draining method to use, and often not very successful, and then
Mhm.
it just continues to perpetuate that cycle because you get the shame and guilt and frustration with yourself in
Oh yeah.
that. Yeah, but I mean, I love the example of the beach ball versus the arrow. I mean, it's true. You react and then you realize, your mind's telling you one thing, like it seems silly. Why the heck would I dodge for beach ball? But it's true. You have that primitive structure that keeps you safe and is keeping you alive, that to override that is tremendously difficult with willpower alone. You have to learn another route to go about that, for sure.
Exactly. Right.
um
Resolving it.
I feel like we could talk all day. I feel like we got to do part two for this.
Sure. Whatever.
But any take-home messages, anything that you want to kind of give a synopsis on, or just anything that you want people to take from this?
Yeah, so the big thing that I'd like people to take from it is that the system is complicated, and understanding why the medical system has failed you so much to this point is not because there's anything wrong with you. It's because we have failed to identify the pathways in the languages that it speaks in order to solve the problem. So they keep trying to force you into the old model, the old system of, oh, this is a willpower thing, this is a serotonin thing, this is a pure chemical imbalance thing. And it's like, well, the chemical imbalance does exist, but why, right? And until they start figuring out that there's a why that precedes the chemical imbalance, they'll continue to fail you. And until they realize that histamines in its complex form of communication is a huge piece, right? They couldn't even make a medication for it because they don't have a good medication for central nervous system histamine release, right? And they got all the other stuff in the body, but that doesn't make it into the brain well, right? So it goes, yeah, there is a primary pathway that's talking, but there's a reason that it's talking. And to hold that shame, to hold the guilt that's oftentimes connected to this, and guilt and shame is a byproduct of this system activating, because for those that don't know the difference, guilt is I've made a mistake, shame is I am a mistake. So if I view myself as a mistake, I have to actually activate my histamine system to solve that problem, because I now am the problem, and I need something outside of my mind to solve that, right? Just fix it, destroy it, whatever. And so you have the sensation and the feeling of, oh my gosh, here comes the shame, I've messed up and all that stuff. And this is to give you a framing to go, I don't need to hold on to that, right? There are things at play that are outside of my conscious control, right? But there's also some hope out there that it is able to be changed if we're able to teach people how to navigate the system correctly.
Yeah, there's so many like golden tokens from that. But I mean, I love that, everything you said. But as far as like the medical system, I think there's such a reliance on people just fix me, or cover this up, mask this, and you have to address it differently, because if you keep going down the same path of just not getting to the root cause, you're never going to actually experience that long-term relief. So yeah, I think that was such a gem that you said there. But it's true, just recognizing that, again, sounds cliche, but knowledge is power. And the more knowledge you have of what's actually going on in your system, the more power you have to make a change. And our brains, our bodies, everything is so very intricate, and so many systems are playing a role in there. And until you understand that it's not necessarily a lack of, like we were saying, willpower, a lack of, your own ability to overcome these things, it's more of just going about things the wrong way. Until you have the right tools, you won't experience that long-term relief, because it just is not getting at the root cause. So yeah, everything everything you summarize there, I think it's just, so many golden tokens can be taken from that for so many people going through chronic pain or an eating disorder, or both, for sure.
Yeah.
I would love to continue to, I feel like we could talk for hours. I'll have to do another part on this for sure. But for sake of time, we're going to wrap it up here. But I will put in the show notes how anyone, if you have any questions or comments for Dr. Spencer Blackman, I will put in the show notes how you can access him and contact him. And also his bio will be there as well. So definitely check it out. Connect with him. He's a wealth of knowledge, and I'm so glad that we could have this conversation and connect again, because it's just, there's so many dimensions to this. I love talking about it and learning more and more and being able to apply this. So thank you for being here.
Thanks for having me. We'll have to chat soon.
Yes, definitely. Sounds good. Well, thank you, Spencer.
All right, bye.